right. Hello, everybody. Welcome to the live webinar with the Doctors Love.Life Telehealth. We're so happy to have everyone here. Thank you. Thank you all for joining us. We have a very special guest today, so we're going to jump right into things because we don't want to waste a single second. So this is someone known and very dear to the lifestyle medicine community and the health community, if you ask me. So I want to introduce Dr. Caldwell Esselstyn. Thank you for being here. Hello.
Hi, Chris. Thank you.
Yeah, we're so happy to have you. So today, you guys, I see you're joining. So please say hello. Let us know where you're coming from. We're happy to have you. So we're going to kind of jump into things here. First of all, we're going to catch up a little bit with Dr. Esselstyn, hear what he's up to, and we're going to jump into heart health a little. So that's the agenda for the day. So first, Dr. Esselstyn, how are you doing these days?
Fine, thank you.
Good. Well, we're going to talk about an oldie but goodie. There's Christina from San Diego. Hello. And Aspen Tree. Hello from Sacramento. And Danielle from Detroit. Donna. Welcome, you guys. So, in this, you wrote a book back in 2007, Prevent and Reverse Heart Disease, which has become a classic, sort of a legend in for us in lifestyle medicine, something that we've built upon. You taught us that heart disease is actually reversible. But here we are 17 years later, and it's still the number one killer of men and women. So can you give us some background on this, some tips, and then some tips on what we can be doing to all be getting healthier and stop this from being our number one killer?
Well, I think the thing that always is interesting to sort of start with is the fact that we as a profession have known really for about probably over 90 or 100 years that there are multiple cultures on the planet Earth where cardiovascular disease is virtually non-existent. For instance, if you try to take your cardiac surgery shingle and hang it out in rural China, Okinawa, Central Africa, the Tarahumara Indians in northern Mexico, the Papua Highlands in New Guinea, you can forget it. You're not going to have any heart surgery. They don't have coronary disease. Why? They thrive on whole food, plant-based nutrition. And sadly, the black eye in American medicine is the fact that we've known that for 100 years. And what have we done about it? Have we taken that information and brought it to the people in this country? Where do you go to learn how to eat plant-based? Doctors are not trained in it. That we start with drugs, stents, and bypasses, none of which have a single thing to do with the coronary artery disease inception or causation.
Mm-hmm. So a plant-based diet, can you give us a little bit of tips? So if people find out that they have heart disease, say they find out their lipids are high, or they get a scan of some sort or some sort of imaging, and they see that they have atherosclerosis and some sort of disease, what can we tell these patients? What should they know? What should they be doing?
Well, immediately what they should do is we'll try to take a few minutes here and discuss the causation, because as I mentioned a moment ago, the causation of the disease is never discussed with your cardiologist. They never have training in whole food, plant-based nutrition. Now, hopefully that's going to change. So what we really have to do is knuckle down and decide. And there's an agreement that where this disease has its inception, its onset, its beginning, is when we progressively injure the life jacket and the guardian of our blood vessels, which happens to be that delicate innermost lining called the endothelium. And it is the endothelium that is responsible for manufacturing a truly magic molecule of gas called nitric oxide, which is responsible for the salvation, preservation, and protection of all of our blood vessels because of the remarkable functions that nitric oxide possesses. For example, nitric oxide will keep all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide will protect the wall of the artery from becoming thick and stiff or inflamed and protect us from getting high blood pressure or hypertension. Number four is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing blockages or plaque. Now, when you think about it, everybody across the planet who has cardiovascular disease has their disease because in the preceding decades, They have so sufficiently trashed, injured, compromised, and turned their endothelial system into an absolute train wreck. Now, that means that they no longer have enough nitric oxide to protect themselves from making blockages in plaque. However, the good news is this is not a malignancy. It is a completely benign foodborne illness. And once you can get patients to understand, never, never, ever again are they to pass through their lips a single morsel that is going to further injure their already train-wrecked endothelium, because then the endothelium can recover, make enough nitric oxide so we can halt any disease progression, and we often will see elements of disease reversal. So, what are the foods that every time they pass our lips, we injure the endothelial cells? One, any drop of oil. Olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil in a cracker, oil in a chip, oil in a piece of bread, oil in a salad dressing. You have to ask your patients, do they ever eat oil? Got to get them, obviously, to stop oil. Oil is a killer. Also, we want to eliminate animal protein. Meat, fish, chicken, fowl, chicken, and eggs. Also, we want to eliminate dairy, milk, cream, butter, cheese, ice cream, and yogurt. Be careful of sugary drinks, Diet Colas and Pepsi. We want to get rid of sugary foods, cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey. We want to eliminate peanuts, peanut butter, nut butters, cashew sauce, and avocado, and coffee with caffeine. Now, what are you going to eat? What are you going to eat? All those marvelous whole grains for your cereal, bread, pasta, rolls, and bagels, 101 different types of legumes, lentils, and beans, all these marvelous red, yellow, and green leafy vegetables, white potatoes, sweet potatoes, and some fruit. And I should share with you that I made a significant change in the program about a decade ago, and I want to share with you what that was about. When it came about because of a recognition that the endothelial production of nitric oxide is age dependent. You never heard of a boy or a girl at age 8 having a heart attack, right? They have nitric oxide coming out of their ears. But by the time they are beautifully healthy at age 50, they now have 50% of the nitric oxide they had when they were age 25. And by the time you're 80, you've lost 70%. So the changes I made were two. One was a greater stimulation of the endothelial production of nitric oxide. And number two was I embraced the newer research that shows us that mankind has an alternate pathway for making additional nitric oxide. So here we go. Now this is a patient who has heart disease, right? I need you to chew 6 times a day a green leafy vegetable, approximately the size of 1/3 of a cup, after it has first been steamed or boiled 5.5 to 6 minutes so it's nice and tender. Then you must anoint it with several drops of a delightful balsamic or rice vinegar. Why? Because research has shown us that the acetic acid from those vinegars can restore the nitric oxide synthase enzyme, which is contained within the endothelial cell and responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich. That's 3, mid-afternoon 4, dinner time 5, and of course I adore it when you have that evening snack of arugula or kale. Now, the second benefit from chewing the green leafy vegetable, it restores the capacity of your bone marrow to once again make the endothelial progenitor cell, which will replace our senescent, injured, worn out endothelial cells. The third benefit, when you're chewing a green leafy vegetable, you are chewing a green nitrate. As you chew the green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce the nitrate you've been chewing to nitrite, and when you swallow the nitrite, it is your own gastric acid, which further reduces the nitrite to more nitric oxide. So think about it. What you're doing, and with minimal expense, no side effects, literally all day long, dawn to dusk. You are absolutely restoring nitric oxide, the very molecule, the deficiency of which gave you this disease in the first place. Now, there is a caveat to this. Toothpaste with fluoride, public drinking water with fluoride, and mouthwash will injure the beneficial bacteria in your mouth. I do not like antacids because antacids will decrease your gastric acidity and you will be unable to reduce the nitrite to more nitric oxide. And the top 6 vegetables would be kale, Swiss chard, spinach, arugula, beet greens, and beets. Now, if you want the whole group, it goes a little bit like this. Bok choy, Swiss chard, kale, collard green, beet greens, mustard green, turnip greens, nappy cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula, and asparagus. And the reason I go through that, is because it not only is it fun, but it reminds the listener that whole food plant-based nutrition can do wonders for your memory.
There it is. See that? Yep. I love that when you sing your little jingle. I always forget that cilantro and parsley are part of that. Adding those fresh herbs is going to add boost our nitric oxide. So that's interesting. So can you tell me, a question that comes up to me from my patients when they hear you talk is, do the greens have to be cooked with the balsamic vinegar to get this?
I think it doesn't have to be, but I think that there's some data that indicates that when you cook it, it further makes it more possible to access and break down the membrane to access all the phytonutrients that are in the green leafies. Okay.
And
but you get caught in the middle of the morning or the middle of the afternoon, and you can just it's certainly fine to go ahead and eat it raw.
Yeah, like if you eat a salad and you get your vinegar, hopefully you're getting a little nitrogen.
Yeah, but the key, remember, it's the vinegars are the ones that really spice up the enzyme.
So making sure.
Nitric oxide synthase enzyme, yes.
Okay, and so and that was balsamic vinegar and rice vinegar to add to our.
Yeah, the reason I limited it to those two is those are the only ones where I've seen the research.
Oh, okay. Okay, interesting.
Because people often ask, why can't I use apple cider? Well, I've not seen any data that indicates that will do it.
Have you seen the data about how breathing through your nose can increase nitric oxide? Do you know anything about that? Is that enough to actually give us a different?
I've heard about it, but I don't know a lot about it, except it seems pretty automatic. But I think if you're exercising and you get short of breath, it's easier to breathe through your mouth than to do it unless you got very clean nostrils.
No, for sure, to get enough air in fast enough when you're exercising. And then a question I have is, what about the lifestyle factors? So can you touch on the importance, if we're reversing heart disease here, what about exercise for that person? What about?
There's no question that exercise is a realistic bonus. I mean, you have to choose an exercise that you enjoy enough so that you don't have to force yourself to do it. You want to really make this sort of an integral part of your daily life. Whether it's swimming, whether it's biking, whether it's walking, whether it's running. I mean, all these things are beneficial. But again, you have to use the common sense. If somebody's recently had a heart attack, you better give their heart a chance to heal before they get into exercising.
Awesome. And so what about lipid numbers? Where does that fall? If someone's following your diet to a T, let's say, but their lipids are still a little bit high, their LDL, their total cholesterol, what should they be worried? What should they be? What do you tell those people?
Yeah, that's undergone a fair amount of evolution, because every now and then you sort of wake up and you see that a patient with familial hypercholesterolemia, where nothing seems to bring it down, live into their 90s, and so that you have to. The way I look at this, there's no question that cholesterol seems to have earned a spot. But we're not really, I think, 100% clear yet whether cholesterol is a participant or whether it's an observer. And by that, I mean, let's take the example of, let's suppose there are, as often happens, there are people who come to our seminar who have learned long before they ever heard of me that they were unable to take a statin because of the side effects, that it was injuring their liver, it was giving them terrible muscle cramps, it was giving them diabetes, or it was giving them brain fog. And so the statin is not for everybody, but they can't take a statin. And even if they're following our program correctly, let's say their cholesterol is still 180, 190, 200, 220, those patients are going to probably be absolutely okay if they do the following. Because when you are, because we found that in our program. I mean, I'm very close to a number of people who have never had a cholesterol below 200 for the last 50 years, 40 years, and no problem. Well, no problem. Why? Because when you are eating whole food plant-based nutrition, it is so anti-inflammatory that in other words, what you've done is you've sort of created yourself what I call an endothelial fortress, so that even if you happen to have a few extra molecules of cholesterol coursing through your bloodstream, it cannot stop and find a crack, a fissure, an opening, or inflammation where they can initiate the formation of a plaque.
Right, and it's the combination of the inflammation and some inflammatory.
I feel the same way about LP small a, because LP small a, it is a fact that almost all cultures, 20% of people will have an elevated LP small a. Okay, now that means rural China, Okinawa, Central Africa, the other countries I mentioned before that never have heart disease. Wait a minute. 20% of that group has elevated LP small a, heart disease. Why? Because probably they are eating in a way that is so anti-inflammatory. Their LP small a can't kickstart plaque formation or block it.
Interesting.
But it's got to be 100%. For instance, I have every now and then, somebody who's read my book will call and say, Dr. Esselstyn, you'd be proud of me. I'm following your program 85%. And I said, wait a minute. I don't know whose program that is, but it's not ours. What you're telling me is that 15% of the time, every day, you are further injuring your already injured endothelial cells. Now, I'm sure from that you understand that the reason that my program succeeds where others fail, nobody else is as mean as I am. And, yeah.
Well, I know you're not mean, but you are strict with what you want.
I think I hate failure, and patients have to know that what is so exciting about this is we are empowering them as the locus of control to be able to absolutely halt and theoretically often reverse their disease.
Mm-hmm. Mm-hmm. Excellent. Well, we have several questions, and we're about to jump into a few of them, if that's okay, in the last about 10 to 15 minutes we have left. But I just have one more question. Can you pick up any tip, do you notice any characteristics in people that are successful in reversing? Like, what do you think it takes for people who are out there who are trying, who are struggling? Like, can you give us any inspiration to keep those people on track?
Just do it 100%. In other words, let me give you an example. A couple that I it must have been a month ago or so, but it's still fresh in my memory. Her husband had a heart attack, and I went through the whole 9 yards with him for about 30 to 40 minutes, all about endothelial cells, nitric oxide, everything. We got through, and the wife said, Dr. Esselstyn, you haven't told us what are the cheat days. The cheat days? You mean CHEAT? Yes. You mean if your husband is good all week longer and on the weekends he can eat what he wants? Yeah, that's the idea. I said, you know what you just said? You want him to have that twice a week. That means 104 days out of 365. You're destroying his few remaining endothelial cells to set him up for the second heart attack. Oh, my goodness. I didn't think of it that way. But I think I think if people can gather and understand the mechanism of how the disease is formed, namely it's a nitric, think of it as a nitric oxide deficiency disease. And are you doing something every day to enhance your nitric oxide, or you are doing something to further injure your endothelial cells? Then it really becomes, it's not brain surgery.
Excellent. I love that. Thank you for sharing that. It's good sometimes to go back to the mechanism and the physiology, which sometimes that's what it takes to keep us on track 100%.
Let me just say what happens. Most people, when they go to a restaurant, they say, Dr. Esselstyn, but I can't do it. If I go to a restaurant, they often have oil. No, I said, here's how you deal with it. First of all, you don't ever bury your head in the menu and say to the waitress, go easy on the oil. What you do is you turn in your chair, look them squarely in the eye and say, understand this. I am deathly allergic to a single drop of any oil. Oh, my goodness. She sits down next to you. You go over the menu together. It's all oil. So then what you do is you flatter them. You ask to see the chef. Chef comes out. Say to the chef, deathly allergic to a single drop of oil, cannot have animal protein, dairy, or sugar. And he comes back in about 21 minutes with a lovely plate of beans and rice, where it might be a baked potato with a vegetable. But you never go to a restaurant to further destroy more endothelial cells.
Good way to think about it. It's a good perspective. Thank you for presenting it like that. So it gives us something to think about. Let's take a couple questions, if that's okay. We're going to stick to questions related to heart disease for today, if that's okay with everybody. So I'm just going to kind of read through some of these. You already talked about fluoride in the toothpaste and mouthwash, so we'll skip that. Is there an optimal TSH level for lowering LDL that you know of? Lori wants to know.
No, your TSH, was that what you asked?
TSH.
Just have it in the normal range.
Normal range, excellent. She can't take statins. You heard from Dr. Esselstyn that work hard on your anti-inflammatory plan here. Let's see. Hello, everybody. Hi, Kim from Colorado. Leslie, Jim. Let's see. We have eaten whole foods, plant-based for 14 years. Can a high homocysteine, 14.3, now normal, B12 of 1,000, block arteries in leg and neck in a 74-year-old? That's from Linda from Canada.
The question was, what was going to block?
So high homocysteine, and can that cause problems to this person?
I think the thing to do is to look over your menu and write down everything you're eating, say for a week or so, and see if there's any mischief in there, because homocysteine will respond when you have adequate B12 levels, and certainly if you're eating as carefully as we've indicated.
Okay. Leanne has a good question for you. Leanne has a good question for you. Aren't the blue zones areas where people eat fish? Do you advise against eating fish, and if so, why?
Because the reason I don't like fish is that it's animal protein, and you look at the study by Ansel Keys years ago when he looked at autopsy rates of the Inuit in Iceland, I believe it was Iceland. They're loaded with heart disease with all that animal protein and fish protein. Yeah.
Mm-hmm.
That's the question about somebody wanting to eat fish.
Mm-hmm. She wants to know why you don't allow it in your plan.
Well, hey, listen, it's America. You can eat the fish, but I have reservations about it because it causes disease. What do you think that any Eskimo is noted for their longevity? They're noted for their early demise. They often die in their early and mid 40s. They have terrible diets. Yeah.
Mm-hmm. Thank you. Chris says, the OG Esselstyn, what a privilege. And then Chris says, but what are specific negative impacts of alcohol on heart health?
Well, it was interesting. If you follow the path of alcohol over the last 20 years, there were these fluctuations up and down. And finally, after people began saying that a small amount might be beneficial for your heart, that has absolutely now been blown out of the water. Alcohol is a toxin. There's no way around that. It's toxic to your brain. It's toxic to your heart. It's toxic to your liver. What happens to alcoholics? They get the cirrhosis. they can get alcohol disease of the heart. And but since I'm such a mild-mannered, easygoing, my patients plead with me. I say, maybe you can have a half a glass of wine once a week. Because remember now, that's 52 times a year. But better yet, I mean, I encounter people who say, well, now, Dr. Esselstyn, you will not interfere with my evening. My evening habit is 3 glasses of wine. And I said, absolutely, I'm going to interfere with that. I think that's terrible.
Excellent. Thank you for clarifying that. Rochelle says, which test is most reliable to confirm you have heart disease? What should people be checking? ApoB or something else?
To detect if you have heart disease, probably either a calcium score or a CT angiogram.
Okay. Do you recommend a calcium score for everybody? If they're wondering if they have heart disease, let's say.
Well, I think I would first take a careful history and do the usual things. And why did the patient come to me with a question about heart disease? If they're really desperate to be sure that they don't have something brewing, yes, I think a CT calcium score would be very safe and very illustrative and very informative.
Great, thank you. Rochelle has goes back to the basics here. If anyone has plaque in their arteries, whether that's shown on a calcium score or a Doppler ultrasound, does that mean they have heart disease? What constitutes heart disease?
Oh yeah, if they've got a positive calcium score, that means that there is a blockage or a plaque with some calcium in it. And the reason that also has to sort of pick up your ears a little bit is that if they have a plaque that is calcified, there is also a strong likelihood that they have other plaques that are not calcified, and they are the ones that are more inflamed, more dangerous for rupturing and causing a heart attack. So I think that when you have a calcium score, it's important to pay attention and think about making a lifestyle transition that we've been talking about.
Excellent. Thank you. Sue has a good question. Does beet powder count?
So
instead of having beet, she's having the powder, like in, does that?
Yeah, I don't know of any downside to that.
Excellent. Yes, a couple questions about beet powder. Brenda says, very, very grateful to you, Dr. Caldwell. Myocardial infarction in 1996 with angiogram. Follow-up angio last May, 0 blockage. New cardiologist doesn't believe I ever had a heart attack. He can't explain how changing my diet can mean 0 blockages. Well done, Brenda. That's awesome.
Have the doctor who has questions read my book.
Yeah,
or go to the website.
Give them the book. That's awesome, Brenda. That's really amazing. Thank you for sharing that with us today.
Great.
Yeah. William says, I'm 61, had a heart attack with quintuple bypass surgery last year. Doctors put me on a high-dose regimen of statins, blood pressure meds, etc. Will a whole food plant-based diet help me, or is it too late?
Oh, no, absolutely. It's going to help you from making any disease progression. I think that's terribly key.
Yeah, I agree. It's never too late, if you ask me, until we're not alive anymore.
No, I'm the oldest patient. Well, I've had several that's now in the 90s, but for the longest time, the oldest patient that I started with was 87, and he was from the West Coast, and he was he had enough disease that they were aggressively pushing him towards having bypass surgery, which he thought would kill him. So he came and became plant-based, and usually once or twice a year, he'd give us a call, let us know how he was doing. And last year when he called, he wanted to speak with Ann. And he wanted to speak with Ann because he wanted her to give him a bundle of recipes because he was having quite a party. And Ann couldn't resist saying, well, what was the party about? And he said, well, I'm celebrating my 100th birthday. So
wow, that's awesome.
So that was last year. Now this year when he called, he said, I just wanted to be sure to remind you that I'm now 101.
That's awesome. Wow. So there you go, guys. It's never too late. You got a long way to go. Alan has a question. Remember, you guys, none of this is medical advice. We're just talking in general, so be sure you're working with your healthcare provider. But Alan says, are you seeing patients with factor V Leiden and prothrombin, some mutation? His doctor has told him to stop eating greens such as kale and spinach because it causes him to clot. He's been whole food plant-based for several months and have recently developed a blood clot in his leg. So he's taking warfarin now and enoxaparin.
Yeah, and what is he doing? They're blaming the clot on his spinach?
Perhaps with his factor V Leiden and his prothrombin mutation. Mm-hmm.
Factor
V Leiden.
No, I'm gonna defer on this one because I make it a point never to say anything that's going to drive a wedge between the patient and their physician.
Yeah. Yeah, I don't know about that either, Alan, but I would say you can still eat other healthy whole plant foods. So maybe a little more research and work with someone who can help you still build a healthy diet. So I'm not sure about that either. What about algae oil or omega-3? Jim wants to know.
Yeah, I think omega-3, if you get it checked, it'll either be optimal, moderate, or deficient. And it probably is not inappropriate if you're deficient to see if you can't kick it up into a normal range with the supplement.
Mm-hmm. Yeah, and remember, you guys, some people can convert the flax and chia seeds, the ALA into EPA and DHA. So if you are deficient, it's worth maybe making sure you have a good source.
Flaxseed meal, Chris, that's an excellent choice. Or chia seeds, and of course, mm-hmm. green leafy vegetables themselves.
Mm-hmm. Absolutely. Video share says, love you, Dr. Esselstyn. Thank you for all you do. You have changed the world. So thank you, Dr. Esselstyn. And we're just going to take a last few, you guys, so we can wind down. But M. Schneider says, why is coffee bad for us?
I'm sorry?
Why is coffee bad for us?
Oh, there are two studies, one a Greek, one Italian. Let's talk about the Italian study. You take a group of healthy young subjects, divide them in half. One half will have coffee with caffeine, and the other half will have decaf. And after they've drank the beverage, you then do the brachial artery tourniquet test, which is a test for the production of nitric oxide. So after each group rated, they did the nitric oxide test. Then they switched groups. The group that previously was having coffee that was decaf was now drinking coffee that was caffeinated, and so forth. When they tallied up the results, it was always the group that was having coffee with caffeine that injured the endothelial production of nitric oxide.
Interesting. Yeah, I think acute ingestion of caffeine does cause the vasoconstriction, like you're saying. Long term, maybe it may not be as detrimental, but short term, it can be harmful, especially for people super high risk. Roger says, how does sugar damage the endothelium, or does it?
Yeah, you have to. It's not as commonly understood, but there is I think enough data out there to show that the high levels of glucose and sweeteners and so forth are able to somehow, I think, contribute to the inflammation, which then, of course, is going to contribute. But I'm very adamant about asking my patients to be very careful about sugar.
Mm-hmm. Excellent. Thank you. It is, he's right, that even the American Heart Association has limited the amount of sugar that all Americans, that's public knowledge, not just plant-based. And nobody seems to follow it, but it's only like 6 teaspoons for women and 9 for men or something like that. It's not very much. And that's for this reason, but that is not well known, as you said. Okay, last few questions. We're almost done. So Chris says, thank you for your honest response, Dr. Esselstyn. And then video share, whoever you are, you have good questions. Can you change your calcium score?
Can you change your calcium score? I first learned about calcium score probably about 15 or 18 years ago in a conversation with Dr. William Castelli, who for 30 years was the director of the world-famous Framingham Heart Study outside of Boston. And Castelli said that when a physician orders a calcium score, it gives you two pieces of information. One, it tells you that the patient does have coronary artery disease. He said, and it doesn't show you what he said, but it tells you that that patient also will have some non-calcified plaque that you do not see on a calcium score. Then he said, but let's do this. Let's take the example, he said, of somebody who gets a calcium score and it's 440. But over the next year, they absolutely get it right. And they're totally committed to whole food, plant-based nutrition. And they get another calcium score. And it's now 550. Even though it's elevated, he said the patient is now much better off, because what has happened is the following. During that year that the patient was following completely accurately whole food, plant-based nutrition, that's such an anti-inflammatory approach that the patient those plaques become calcified as the inflammation is going away, and because the body is trying to make it so that plaque is less dangerous. So by committing with the whole food, plant-based nutrition, you absolutely are completely squelching the inflammation. And he said it's as though the body wants to get in on the act to try to hasten along the quelling of that inflammation, and it will deposit some calcium in those previously non-calcified inflamed plaque, so that they now cannot rupture or make the disease worse.
Mm-hmm. Excellent. Yeah, it becomes more stable. So really, we don't repeat those usually.
It'll. But the thing is, you've got to often educate your physician that if you're following plant-based diet, and he gets another calcium score and it's going up, and he tries to, it's not getting worse.
Right. So you may not want to repeat it for that reason, so that you don't have to deal with that increased number. But Roger, we're going to end with this last question. Sorry, guys, for the rest of your questions. You have so many good questions here, but we're already way over time. Roger says, what is the best way to track your progress? So once we're following this diet to a T, a year passes, what should people be doing?
Well, it's important to let you know how rapidly sometimes this can happen. For example, when we do a PET scan on somebody, I've got this in my presentation. The PET scan will show, when we first see this patient, a portion of the heart muscle that is ischemic. It's not getting its due supply of blood. But then we repeat the PET scan 3 weeks later, and you will see that the area that was previously poorly perfused is now perfused. And it's really quite profound how rapidly something like that can happen. Now, what about everybody's totally different? We've had some people that I've followed them, and actually they have been the ones that have insisted on getting an angiogram. And it took them about 2.5 to 3 years to make it completely going away. On the other hand, there's going to be some plaques that are made up of scar and fibrosis and calcification, where you make it so that they cannot rupture or cause a heart attack. They're not probably going to go away very much. So it really is so exciting how rapidly things can happen. I just had something that I'd never seen before, and that is a gentleman from Seattle had called me because he had, in this past November, he began getting abdominal pain when he was eating. And he saw some physicians. They thought maybe it was diverticulitis, which is some disease of the colon, but that didn't tap out. And he called me in just January of this year, because they have done an ultrasound of the arteries to his intestine. And the main artery to the small bowel, called the superior mesenteric, was 75% blocked. So when he would eat and all the blood would try to rush to his intestine, it really couldn't get the job done. But he absolutely stuck with the program. Remember, this was this past January. I got a call from him the other day because he he had decided to go get a repeat ultrasound of this artery because his pain had gone away. The blockage was gone.
Wow. So January, February, March, within 2 months, 2 to 3 months.
Yeah, therefore that plaque had to be made of inflammation, fat, and cholesterol, something that the body can really aggressively reverse.
Wow, wow, that's amazing. Well, that's inspiration. That's the story we're going to leave you guys on. If you don't feel inspired now to eat clean and protect your endothelium, I don't know what it'll take, but hopefully you all do. So, yeah. I just want to say thank you, Dr. Esselstyn. Those were hard questions, so thank you for taking those questions.
Oh my goodness, it was a pleasure. Thank you so much, Chris.
Yeah, you're welcome. And thank you everyone for joining us today. We're happy to have you. And we won't have as special of a guest next week. It might just be some of us doctors, but thank you everyone. And again, thank you, Dr. Esselstyn. And I just also, for those of you who don't know, these are Dr. Esselstyn's books from a while ago, but recipes by Anne and family, and Anne and Jane. And there's newer books as well. But if you haven't read his books, you're not familiar, you can get a lot more detail about everything he's done.
Be a plant-based woman warrior.
There it is. Be a plant-based woman warrior. That's Anne and Jane's new book. So check it out, you guys. So thank you again. Take care, everybody. Take care, Dr. Esselstyn. And
you're welcome. Bye-bye.
See you all next time. Bye.